Welcome back to Medical Monday. Dr. Susan Briley here with me, talking about colon cancer awareness and colon and rectal cancers. If you have a question for her, go ahead and get on the line. 615-737-PLUS is the number to call. We have Celine on the line. Want to get right to Celine. Good evening. Thank you for calling in.
How are you?
Good.
Hello, how are you?
We're doing great. Go ahead with your question, Celine.
Thank you. I had a colonostomy almost exactly 8 years ago. It will be 8 years ago this year. And I was having blood sometimes, blood. I'll just leave it like that. I don't want to be too dirty. But anyway, I had a colonostomy, and I had it at Vanderbilt, and it was students because it was cheaper, and it wouldn't cost so much money. And the gentleman, I got to watch, and it was fun watching. I enjoyed every minute of it. I had saw Dr. Oz do his, and he had trouble, so I went and did mine. And his was nice and smooth and flat and looked great and, looked perfect. And mine looked like I-440, and I am not kidding. And the gentleman, when it was all over, said he had never seen anything so bad in his life. He said he had only seen one other person that had anything similar, and he said they were not as bad as mine. And I've had an aunt and an uncle both die of stomach cancer. And I have trouble eating pumpkin seeds, sesame seeds. I have trouble eating corn. Have eating cherries.
Did the doctor say? Did he say that you had diverticulosis?
Yes, ma'am.
Okay, so that's why it looked like potholes, I guess you're describing it.
Okay.
Yeah, that's a very common condition in Americans, diverticulosis. And not everybody with diverticulosis gets diverticulitis, which is an infection. Diverticulosis are these little pouches that develop along the colon, probably from low fiber, high meat, low vegetable diet. So it's very common, but it can get infected, and then it's diverticulitis. That's actually a whole nother show, but I do recommend for those patients that they get on a psyllium fiber product.
Okay.
That's Psyllium. It is not at all related to colorectal cancer. Now, sometimes some of the symptoms can overlap as far as the change in bowel habits and bleeding, but getting the colonoscopy was the right thing to do. And there can be some symptoms with food intolerances, and if those other things happen that we were talking about, more bleeding, weight loss, severe diarrhea and constipation, sometimes we may have to repeat that colonoscopy for diagnostic purposes.
Celine opened the door, so I'm going to go there. What should the nice, perfect, healthy colon look like?
Orangey pink velvet with some folds.
What we see in those science books.
Yeah.
Okay.
Yeah.
Okay. Interesting. All right, we have John on the line. John, thank you for calling in. What's your question tonight? John, you with us? Oh, I think we lost John at the right moment. Let's see. Let's go to Joanne. Hi, Joanne.
Hi, hon.
Hi, go ahead with your question.
Well, I'm calling. I don't particularly have a question, but I want everyone to know my sister died of colon cancer. And for those who are afraid to take the test, don't be afraid, because you need to know what's going on so the doctors can possibly help you and not die from it. As far as being uncomfortable, it's like any procedure for a medical procedure. You're going to be uncomfortable, but it's not anything that's going to devastate you. I mean, you're able to drink broth, you're able to have Jell-O, you're able to have things. You get a little weak, and you're actually looking forward to the exam to get it over with so you can have something to eat. So please, you've got to go and have this exam.
Yeah, Joanne, thank you for calling with that word of warning.
Thank you so much for
I've
that.
had 3 because of my sister, and like I say, they're uncomfortable, but I want to know the answer. They found a couple polyps, and they were cut out, so I don't have, and it's something you've got to do. Man, woman, you've got to do it. Don't be afraid of it. Just grit your teeth and do what you got to do, and it may save your life.
Yeah, very much so. Joanne, thank you for sharing that with us tonight. We appreciate it.
Okay, thank you.
That's
Bye-bye.
great.
And just a reminder, as in Joanne's case, I mean, she's being very vigilant, but if a family member has been diagnosed, that increases your chances, right?
Yes. A family history of colorectal cancer does increase your risk, even if you don't have one of the genetic syndromes. So, as I mentioned before, get your first screening colonoscopy 10 years before. But if you had a parent or a sibling who had colon cancer even in their 60s or 70s, then we do like to increase the frequency and decrease the interval to 5 years.
Gotcha.
If it's a first degree relative. Not so much for aunts, uncles, and grandparents unless there's, a whole big family history, and that's, that's a whole nother topic. But a first degree relative means that you're at increased risk.
Okay, let's jump back to the lines. We're getting some great questions and comments tonight. Beverly's on the line. Beverly, go ahead with your question.
Yes, hi you all.
Great, thank you.
I had a colonoscopy about 4 or 5 years ago, and they did find some pollen, but I am scheduled to have another one next month, and I wanted to know, would you advise for me to have that done?
Absolutely. If you have a personal history of polyps, we make a recommendation based on when your previous scope was done, how many and what kind of polyps. So when I do a colonoscopy, and let's say it's the patient's first colonoscopy, and I find some polyps, we remove them, we send them to the pathology lab. It usually comes back within a week, and we look at the number and we look at the type, and then there's a table that we can refer to that guides us on the next colonoscopy. So if you just have 1 or 2 small polyps, then we'll say 5 years. If you have multiple polyps or a large polyp, which we call an advanced adenoma, then it might be 3 years. And sometimes we'll remove a very large polyp. I'm not sure I got it all. You may need another colonoscopy in 3 months, 6 months, 1 year, 2 years, and that's something that you talk to your doctor about. But I have a little system where we notify the patient of when they will be due for their next colonoscopy, and then we have a recall list.
Sure.
Too. So if you move, let your doctor who
know.
did your
Yeah.
endoscopy, your new address. We give patients copies of their report with pictures, and you need to keep that in a file with your other medical records, so that if the doctor forgets
there's
or
a
moves
baseline
away,
to go to.
Yeah, you've got
absolutely.
that record.
Now, when you say a small polyp versus a large polyp, how large are we talking about? Can you give me a reference?
Well, over a centimeter, which is a centimeter's only about that big. So that's really still small, but to us it's large.
When it comes to polyps, that's large. Okay, we're going to take another quick break. I know that Linda and Seymour are both on the line, as well as a few other folks. So when we come back, we'll get right to your phone call. Stay with us.